How do you feel?
Oh my God, way better than before. Almost normal already.
Yeah, I know. You're walking normal now.
I was limping when I got here.
I know. You called me for right ankle pain.
Right.
But it looks like I saw you how you walk. Seems like it's more than just right ankle pain. Can you just tell me more about your condition, please?
When I go downstairs, I cannot step properly. You know, like
Gotcha.
I gotta go like a baby steps. You know, going down.
Why is that? Is it because of the knee pain or is it because of
yeah,
pain?
because it doesn't have enough strength.
Okay.
You know what I mean? So I feel like the leg is kind of weak.
Okay.
Yeah, so I am afraid to fall
Gotcha.
down. That's why I have to go down slow. Step by step. You know what I mean? I feel a little pain back here, and I also feel tired because I think my body is not balanced when
Gotcha.
I walk.
So out of all three problems, right lower back, right knee, and the right ankle, what is your number one problem? Numero uno, number one problem.
Right, well, I believe that the knee
Easier.
and then the lower back, because when I start walking, obviously I am putting weight on this, so since this is connected to my lower back, so I feel the pain back here too.
Gotcha. How long did you have this problem for?
I'd say from 3 years till now.
Without me going any further, oh boy. Did the doctor ever tell you that your right side is a lot weaker than your left side? Did they ever tell you about that?
They kind of mentioned a little bit, but
They didn't release. Okay.
They didn't really get into it.
Okay, so I want to be able to let you know, I didn't do anything. This is my first time actually examining you.
Right.
I can see that your right thigh is extremely soft. That's a problem because I can definitely see that the soft thigh means that there's a problem for a very long time. It's not supposed to be this soft. Yes.
Yeah, you know why though? My right knee got weak since they pulled out the water, because they took a lot of blood too. That was a month ago though. So my knee got so weak for 2 weeks. I go like, oh God, I can't even walk, But now it's getting straight back.
Gotcha. All right, so they can definitely do it. One thing that I'll let you know is that the thighs and legs always have to be the same size.
Right.
And definitely it's not the right size. And you can tell this is much softer over here. I'm going to go ahead and use the same area so that I can take the measurement.
Okay.
You'll be able to see the differences right here.
Okay.
So right here, if you can see exactly what it actually shows, it says what? 15.5, you see that, right? This is 16, so this is actually 15.5, yeah, right? So I want to be able to show you what this actually looks like. So this, if I just go ahead and do a little bit more, you can see that this is 16, so this is what? 15.9. So that means that there's a 0.4 inches of muscle that has been wasted on this side.
Yeah.
Not only that, this is much softer, which means that you don't really get enough supply.
That's the reason why it feels weak.
Yes. So that tells me already that this is some kind of ongoing muscle degeneration. Just like how your bone can have arthritis, just think about this as a muscle arthritis. You notice that your right big toe is actually not as strong. Push up the big toes. You really have to push up your entire leg to push up the right big toe only, because this is weak. Second toe, please. Yeah, you can see that you cannot really push out as well with the second toes either. How about third toes?
Same thing.
A little bit better, but the second toe is actually, first and second is pretty weak.
You are right. The first toe is weaker than the other ones.
Yes, that's strong. So out of everything, your entire thigh, entire leg, your first big toe and second toes are very weak.
They are connected with.
So each toes right here are connected with different nerves of your spine. So for instance, your big toe tells me either the lowest backbone, lumbar, fifth vertebrae or fourth vertebrae. Second toe being weak, it tells me the sacrum, the tailbone, probably 2 or 3. That's actually weak. And that's the two suspected area on my end after taking your x-rays to be weak. So I'll be able to kind of go with it. So everything that I'm doing here right now is just kind of reconfirming what I found on the x-rays already.
Yeah, it makes sense.
Yeah?
It makes sense, yeah, definitely.
Okay, so go ahead and walk for me slowly.
Okay.
Walk for me slowly, yes. Look straight and then walk for me. Turn around and then walk for me again, please. Yeah, I can see that you are kind of leaning toward right side a little more. You're collapsing more onto the right side. Go ahead and turn around and then walk for me again. And we'll compare before and after. Go ahead and walk for me again. Yeah. You don't have any movement in your lower back area. None of the lower back muscles. Turn around and come back. None of your lower back muscles are actually moving, which means that there's some kind of problem in your lumbar area that is actually preventing the movement. Go ahead and do it one more time for me, please. Okay, do it again. Okay, can you go and squat for me, please?
Look, this is all I can do.
Okay, come back up. Do the squat for me one more time. Again.
And I still feel the pain here.
Yeah. Again.
See, I lose balance.
Yeah, unfortunately, this is due to structural problem that is ongoing. So we'll try to fix that today. Without me looking anything, I can definitely see that you have a lot of tight muscle on the right side. You feel that, right?
Yeah.
It was almost like same thing.
Yeah.
Very, very tight. It's almost like knocking on the wood. This, unfortunately, I have to say, this is fat. That's okay. I got a lot of those. Probably I got more fat than you do. But I want to be able to show you something. This is not fat. That's not muscle either. So I can actually outline here like this. I can outline here like this. This is actually edema, fluid, swelling. So whatever is going on in your body is enough to kind of hold the fluid this much to a point that I feel so much heat on your lower back area.
I see.
Same thing over here, and then without you telling me anything, you didn't tell me anything about your mid back, but I can already tell you have some pain around this area. Why? Because there's a lot of swellings on this side. You feel? Am I correct?
You are right.
Yes. So I'm going to go ahead and run this instrument on you. This is not going to shock you or hurt you, but it's going to be helping me to read some of the heat differential between your left and right side, so that I can tell exactly what type your condition is in. So what I'm going to ask you to do is continue to look straight. And then yes, I've already found a couple of areas that are actually symptomatic over here. Yes, I already see it.
When it's hotter, it's more swollen.
If it's hotter, it's a more swollen. Yes, sir.
Yeah, I can feel it.
You feel it, right?
I can feel that in the lower back a little hotter than.
Pain right here.
A little bit.
A little bit or a lot?
Yeah, I think a little upper.
Right here. Pain?
A little bit.
Alright, so this is L. L stands for left side, so this is right side.
Okay.
This is spine from front to back, this is from side to side. But I want to let you know the reason why you're having a lot of problem in your knees especially is this one. How can I tell and then how do I know? I'll be able to treat your spine only. I won't even touch your knees before I do anything else, and I'll ask you to squat again. So when I know that when you are squatting without me touching your knees and there's improvement, then my theory is right. Then this is the
what is causing the.
Yes, exactly. How I can tell that this is a problem? For a starter, usually this area, these regions right here, are the spinal cords. They send all the nerve supplies to knees. So this is actually responsible for knee regions to start with.
Right.
Secondly, how I can tell this is a problem is take a look at this. You see the teardrop shape over here? That's actually teardrop shape. You see like a small teardrop shape over here. That's actually this. This is actually what we like to call the spinous process that you see over here.
Yeah.
That's actually that tells me what type of rotation your spine is in. But as you can tell, it's facing this way, and then face all the way to this side, and it comes toward to this side.
Oh, that's the
only this one is actually due to this side. This is the reason why you had a lot of rigidity or muscle in your lower back. All that is because this is actually
on the right side.
Yes. That's the reason why you actually had that. Does it make sense to you?
Yeah.
Although you came to see me for right ankle pain, it seems like your knee is actually bothering you most out of everything. So this is what I want to be able to show you, and your right knee bothers you. So I want to be able to show you L, left knee, this is the right knee. That's actually what we like call meniscus. That means that you actually have lost more on the left meniscus as opposed to the right side due to arthritis, but you have no left knee pain.
That's weird though.
No, it's not weird.
No, it's supposed to be like that?
No, it's not supposed to be like this. Let me tell you why this is not weird to me and weird to you.
Oh, okay.
You are thinking, well, I have knee pain, so I must have a knee problem. So I should have more of the degeneration or arthritis in the right knee as opposed to the left side. That's what you're thinking.
Right. This is the other way around.
But what I'm trying to tell you is your knee is not the problem. Your lower back is causing your right knee.
Oh.
So it makes sense to me that your left knee is more I don't know, bad looking like in the x-rays, but the right side is actually not, because your right knee is not the issue. What I'm going to do is I'm going to go ahead and make a contact here. Lay it down. Oh, there we go.
I heard it crack.
Yeah, you heard it crack, and I heard it crack too. In a chiropractic treatment before, how do you feel? How do you feel?
Oh my God, way better than before.
I only did one bone. So walk around, tell me how you feel. One bone. You feel okay?
Yeah, better than before.
How much better do you say after one bone?
I would say out of 10, I'm gonna be honest with you, 5, which is good.
That's good. One bone. I'm not done. I gotta do 6
That's
more.
what I'm saying. This is just the beginning, and
yeah, that's good.
I think it's going a little lower than before.
Yep, I can see that too.
I could have touched the
I know.
floor before. Look.
I know. One bone. 4. You feel the pain right here, right?
Mm-hmm.
Wow.
Yeah, I felt it.
Okay.
I felt it crack.
Oh, I felt it too. Okay. 2 bones. How does that feel?
Still, maybe it went up to 7 out of 10.
So 70% better.
Yeah.
Okay. So you walk better. So let me ask you to if you can squat for me, because this is okay. So yes. So keep it. Wow. Look at you.
Do you see before?
Yeah.
It was here, right?
Yeah.
And then it went all the way here, and now it's like 7 out of 10.
That's good.
Which is good. It's great.
It's very great. Are you happy?
Oh,
Very
definitely.
happy. Okay. You feel pain right here, yes?
Yeah.
Oh, yes.
I heard that.
I heard that too. There we go. Can you walk for me, please? Wow. Now your lower back is definitely moving.
Yeah.
I'll be able to show you after. Come on, walk for me, please. Your lower back muscle was not moving at all, but now it's moving. Go ahead and turn around.
Mm-hmm.
Do it again. Wow.
Almost normal already.
Yeah, I know. You're walking normal
I was
now.
limping when I got here.
I know. Thank God.
Thank God, that's right.
Okay, so turn around. Okay. Okay, stop right there. And then turn around and then squat for me as much as possible. Squat for me, please. How much better do you say the squatting is now? How much easier?
It's like 80.
80?
Yeah, you know what? I think my muscles are a little tight because I didn't run, I didn't walk much. The muscles, but
Yes.
not the knee though. The knee is fine.
So how much of knee? You came to see me for knee pain, the back of the knee. Do you have a pain now or no?
Maybe 9 out of 10 now.
So 9 out of 10, so 90% better?
Yeah.
And did I touch your
90%.
knees?
Yeah, no, when I got here, you know, I was like
I know.
walking slow, and now I can just walk normal.
Did I touch your knees yet? No.
No,
But
only the lower
90%
back.
better? Exactly. So tell me, where was the problem of your knees? Your lower back or your knees?
The lower back.
Yes. That's
I really thought I was the knee.
No. How does your ankle feel?
Like I said.
No problem, right?
90% at this point. An hour ago, I don't know, maybe 2%.
Okay. So I did tell you about the weaknesses over here.
Mm-hmm.
I saw you walk. Phenomenal.
Mm-hmm.
I saw you squat. Phenomenal. So you are actually definitely better in terms of your movement. But the real questions to me and to you is, all the weaknesses on your right leg, does it improve after treatment? Let's find out. You remember that we had checked on your first and second toe, the strength of it?
Mm-hmm.
Let's repeat this. Push up, both of your toes up. Okay? Much stronger. Second toe. Wow.
Everything is getting in place.
Yeah.
Good.
Good.
Thank you.
Good. That's good.
Thank you. Thank you, Jesus.
Hi, this is Dr. Lee. Before the treatment, notice how he is not able to move his lower back muscles, but after the treatment, his lower back muscles are moving left and right smoothly, making his walk to be much more efficient. Notice how much he can squat deeper and flex his knees more after treatment. This is the power of integrative foot ankle examination and treatment. Thank you very much for watching. Take care.